Indiana Jones and the Variant Trackers. It's my delight to welcome back to the health stage Anna Gross, health and science reporter at the Financial Times, who's in conversation with Professor Sharon Peacock. Thank you, Anna.
Thanks a lot, Vernon. Lovely to be back. And thanks to all of you for coming along to this session. So I'm here with Sharon Peacock, who is a professor of public health and microbiology at Cambridge University. She's the executive director and chair of the COVID-19 Genomics UK Consortium. So we're going to be exploring a bit about how the cogUK Consortium came about, some of the characteristics and dynamics of variants of SARS-CoV-2 that we've all heard so much about, and also discuss how the field of genomic sequencing is advancing, and also will help us control the spread of infectious diseases in the future. We'll be having a conversation for the next half hour, but after that, we'll be opening up to you guys in the audience for questions. So please feel free to send them through while we're talking or afterwards in the chat window on your screen. Hi, Sharon. Lovely.
Hello and good morning. Good morning.
Good morning. So to start with, can you tell us a little bit about the story of the genesis of the cogUK Consortium?
I'd be delighted to, but before I say that, I'd just say being associated with Indiana Jones is very exciting. I've been a big fan all of my life, and so have my family. And so if I can be linked to Indiana Jones, that's a very exciting moment for me. But it's not quite as exciting as tracking variants, I have to say. So, I mean, you've asked about the genesis of cogUK, and so back in March 2020, it was clear that we needed to prepare for the eventuality that SARS-CoV-2 would evolve in ways that made it much more challenging to control. I mean, you know, that was predictable, and it was a case of when it would happen rather than if. So we also had a lot to learn about using sequencing as a tool in public health. And we hadn't attempted to use information in such real time and at global scale before. So we had to learn a lot. There's a very steep learning curve whilst learning about a brand new virus. So here in the UK, with the support of our government chief science advisor, Sir Patrick Vallance, we got together a team of around 20 scientists from across the UK. And that included our 4 public health authorities. And that was back in mid-March 2020, when we had less than 100 cases actually in the country. And in that single day, we put together an outline plan for a sequencing network. We developed this into a blueprint within a week. And we were rapidly funded by the government, the UK government, so that our consortium came into being on the 1st of April. So it contains 15 academic sequencing hubs based in universities, the 4 public health agencies of the United Kingdom, and the Wellcome Sanger Institute. And we simultaneously developed everything we needed to wrap around that governance, legal, data sharing, ethical framework, and so on to get going. And so the way the system was designed was that samples from patients in hospitals were transported to our regional academic hubs for sequencing, and samples from the community were sent to the Wellcome Sanger Institute. And a limited amount of data flowed with those samples. Where was the sample taken, when it was taken, who it was taken from. And at that point, once sequenced, everything was uploaded into our cloud infrastructure, into something called CLIME, where the data was checked and the genomes are automatically analysed to define their lineages and mutations. Now, after those steps, the public health agencies can dive into that data, they can combine it with their much more detailed information about outbreaks, and they can perform horizon scanning to detect variants. So, I mean, just to close on this question, it's been a massive team effort. And I do have to say a very big thank you to hundreds of volunteers who've stopped what they're doing to support this. And we've now sequenced more than 500,000 genomes, and it's really through their efforts, you know, that we've done that.
And can you talk a bit about how much you were sequencing before and how much you're sequencing now, just as a kind of comparison?
Yes. So before the pandemic came along, the Public Health England was sequencing around 50,000 genomes a year. That was for foodborne outbreaks and for tuberculosis and other things. We can now sequence about 30,000 a week. So the scale of increase has been really very dramatic. And in addition, the pace at which we can apply the information we learn has actually really sped up too. And so it's an order of magnitude bigger what we're attempting to do now compared with the past.
So I'm in Paris at the moment, and I've been speaking to various modelers, and people who are doing sequencing over here to discuss it, mostly about the spread of the Delta variant. And 2 people now have said to me that cogUK is an absolute reference for the work that they're doing here, and that they're kind of stunned by not only the kind of complexity of the work, but also the transparency, because so many countries that just don't have that level of data access and availability. So I thought I'd share that with you because I thought it was really.
Well, thank you very much. And my firm belief, and our belief, is that open access to data is absolutely crucial. It's the time to share. And it really has surprised me, because often scientists will want to analyse their data before they pass it on to somebody else. But people have been very generous and giving, and just have signed up to the open access policy that we have and put everything into global databases. And given that we're in a pandemic, that's absolutely right.
That's brilliant. I'm interested in how the field itself of genomic sequencing has developed. I mean, in terms of connectivity between people, also between in terms of technologies, and also areas perhaps that you feel there still needs to be more work done. Can you talk a little bit about that?
Yeah, I certainly can. Well, I think one of the things that has really changed for me, actually, the technology was available kind of a couple of years ago as it stands at the moment, but we've moved into a situation where actually sequencing of pathogens has gone from a really relatively unknown beyond the scientific community to it being absolutely centre stage as a tool to help us control the pandemic. And that's been a big change, actually. And the other thing that we've done is that we've been able to show that sequencing technology can make a major contribution to the control of the pandemic. So we can work out what variants are circulating, and after that we can get a better understanding of how they behave. For example, are they more transmissible? Do they dodge the immune system? And this is also linked to vaccine development. So in many ways, the field has advanced because we have applied what we already know to this emerging situation. And I think that coming back to how the field has advanced, actually the data sharing has really advanced us greatly. So in the past, that hasn't necessarily happened, but open genome data as a principle is fundamental. And that in itself actually forms the glue to connecting us all together. You were saying kind of the networking and so on. The actual data is the glue for bringing us all together to try and make sense of what this means so we can control the pandemic.
And in terms of going forward, anything that you'd really like to see in terms of, I don't know, how technologies could be improved?
Yeah, I've got a couple of examples. There are many examples actually, but I think the first thing we need to do is really to work on our machine learning algorithms and artificial intelligence. So we need to be able to more rapidly spot variants of concern at the point that they emerge, really giving us a better chance of slowing down their spread. And at the moment, variants of concern have often gone global, actually, or viral, you could say, but have gone global before we have sufficient information to realise that they're of concern, rather than one of the kind of many other variants that we have no special interest. So for me, early prediction of concern could really change that and help us become more proactive rather than reactive. But also, we need to be able to predict variants that we should be particularly concerned about that haven't even emerged yet. And there's early work in this space, but we don't have a fully developed system for that. I think the second example of real innovation, I think, is something that we really need to help fully democratize sequencing technology worldwide for SARS-CoV-2 and for other pathogens. And that is when the sequencing technology comes in the form of a black box solution. So what I mean by that is you have a sample being tested, you load it into an instrument, and a result is generated that can be understood by anybody without any expertise in analysing genomes or lab methods. And you can imagine a situation where you could take that black box into remote areas of the world to generate rapid information on variants, and could be used for other pathogens, for example, Ebola, where routes of transmission need to be defined to control disease, or even, MRSA in hospitals, where this causes outbreaks. So we're getting closer to the black box solution, but sequencing still requires considerable expertise in the processing of the sample, in the analysis, and so it still remains within the realms of people with advanced training. So I think that kind of AI together with the black box solution could completely revolutionise the way we understand pathogen genomics at the moment.
That is fascinating. I hadn't really heard about the possibility of using AI or using computer technology to actually predict how viruses or diseases might evolve in the future. That isn't kind of incredible to think.
Yeah,
Sorry, go ahead.
People are already talking about that, but you know, we kind of it's relatively in an early stage at the moment.
And it's interesting what you said about being able to work out a little bit earlier whether a variant is of concern. I think that was discussed about what was B117 is now Alpha in the UK. Everyone said, well, why were we kind of sitting not doing anything? Why didn't we act immediately when it emerged? And you said, well, there are hundreds of variants emerging all the time. It's impossible until you actually watch it play out. You can't really tell whether it's concerning or not.
That's exactly right. And you know, it takes weeks or months to really work out whether a variant is more transmissible or it dodges the immune system. And to have a system that predicts that with confidence would be just fantastic, actually, and make a big difference.
So one of the things I wanted to discuss with you, because I think everyone's become a bit of a armchair expert on genomic sequencing, or not necessarily genomic sequencing, but variants, mutations, things like that. But I feel as though we don't have much of a sense, or that the mutations and development and evolution of SARS-CoV-2 is not put in context of how other viruses develop and evolve. And I was wondering, can give us a sense of the speed at which SARS-CoV-2 is mutating and evolving as compared to other viruses, just so we can kind of contextualize it.
Yes, well, actually, SARS-CoV-2 has a relatively low rate of mutation compared to other viruses. So it's half the rate of influenza and about a quarter of the rate of HIV. But actually, I think it's important to not focus on that too much, because you can get lulled into a false sense of security about the rate of change of the virus and how much trouble is going to be in store for us. So you could say it's not mutating much, that's not very problematic. I think for me, what's really important to acknowledge is that when there are 170 million cases or more of SARS-CoV-2 on the planet, that gives the virus a whole lot of opportunity to mutate. And for mutations that provide a fitness advantage to that virus to be kind of selected out into the population. And, you know, variants of concern are actually really very rare, but they create such intense problems for us that this is not a numbers game, as far as I'm concerned, of how often the virus mutates. It's more to do with looking at what a very small number of variants could do in terms of their impact. And we've seen that can be really quite considerable.
So it doesn't really matter the speed at which it's evolving or mutating necessarily, because it just takes 2 mutations and they could be really severe.
Absolutely. And in particular, the Alpha and the Delta variant with their increased transmissibility, and the Delta variant that can dodge the immune system, you know, that there's a limited number of mutations that have arisen there. So I think this numbers game is perhaps less helpful than it might appear on the surface.
Do you think it's possible for us to prevent the spread of these variants across borders, which seem to be the policy direction that some governments are taking? And is it desirable to try to do that?
Well, there's desirable and then there's feasibility, I suppose. So, you know, ideally we'd stop important variants in their tracks as soon as they're detected. And that's where kind of perhaps AI and global systems of tracking could help us. But, you know, there are several challenges to doing this. The first is that we know that people can be infected and transmit the virus with absolutely no symptoms. And that makes control across the border much more challenging unless testing is absolutely universal. I think the second problem is that many places in the world, they don't have access to sequencing. We have a very fragmentary picture as to where and when variants are emerging, which is also challenging for border force planning. And I think third, there's very different levels of border control in different countries, as you've kind of alluded to, and each country makes the decision that's right for them. But what that means across the world is that travel continues and borders are porous. So that gives variants the gateway to spread. So, you know, prevention is desirable, but, you know, stopping the spread of variants across borders requires ongoing efforts. And to do that, you know, absolutely would require absolute border control. And I'm not altogether sure that that is, you know, that's feasible, actually. So there's the desirable and then there's the kind of practical and feasible from my perspective.
Mm. And before I go on, I just want to say we'll be kind of drawing our questioning to a close in the next 10-15 minutes. So please send in any questions in the chat box if you have any. We've got a huge expert here, so send stuff in. So talking about border control, what to your mind? I know people hate to forecast, and they've hated it more and more as time has gone by over this pandemic. But what is likely to happen with the Delta variant that we're hearing so much about? Is it going to become? Is it just a matter of time before it becomes dominant in the world?
You know, that is incredibly difficult, like many other things, to predict. There's characteristics about its biology, the increased transmissibility, that would make you think that it would behave like the Alpha variant. And we know that the Alpha variant has gone global. And when it enters into a country, it often dominates. So, you know, in the UK, it's causing 90% of disease now. So it has replaced Alpha. So as a matter of principle, we know that Delta can replace Alpha. If it's introduced into other countries, and it's actually in 65 or more countries at the moment, you might expect that it would actually replace variants in other countries. And so I find it difficult to predict. But if I was in a country where this Delta variant wasn't yet, or was at very low numbers, I'd be particularly concerned to try and control it and suppress it as much as possible, because my suspicion will be that it will actually take a foothold in other countries in the same way that it's done in the UK. I mean, really simply reflecting on the Alpha variant and the way that's behaved. So why would the Delta variant be any different? And the key is the introductions, those early introductions. And so Delta was introduced into the UK and then transmitted through community spread. And so if Delta is being introduced into other countries, I would anticipate it would start to spread in the community there too. But predictions are quite dangerous things, aren't they? So
yeah.
But that's my best guess at the moment.
Well, again, here in France, we're at roughly 2 to 4% of cases are the Delta variant at the moment, and it's roughly around there for a lot of Europe. Germany around 8%, Belgium's 10%, if I'm not mistaken. And yeah, so it's just interesting, and we're getting all of these clusters of cases that we saw quite early on with the UK, and these big attempts to just limit those, just do contact tracing, and also targeted vaccination, which is similar to the tactics that we use in the UK. There's a big question mark over, is it just a matter of time? Are we going to see exactly the same dynamics play out as they did in the UK?
I mean, what other countries will need to do, I'm sure, and they're doing, is to track the data day on day, week on week. And you know, I think if you have exponential growth, then 2% goes rapidly up the kind of exponential curve, and that's what we saw. We saw exponential spread of the Delta variant. So within a short space of a couple of months, it had replaced the Alpha variant. So I think that for countries where we're controlling Delta at the moment, it's going to be great news if they can control it. But I'm sure they'll be watching that data as closely as we did, as they also roll out their vaccination program, which is the key plank of our control in the UK, like elsewhere.
Oh, just sorry to put you on the spot here, but you said, you know, Alpha spread around the world. Do you happen to know what percentage of the world's genomes, at least as according to GISAID, are Alpha at the moment?
I don't. You have put me on the spot. I can probably check it out for you by the time we finish the program, because I've got all of my bits of kit in front of me. So I'll see if I can come up with that number. I
just asked because the sense I get is that there are some regions of the world which have where other variants have had a competitive advantage. So, for example, Brazil, Alpha hasn't taken control, and that the P1 variant, I don't know what its new name is. That's remained dominant there. So there does seem to be some geographic differences in which variant competitive advantage.
Yeah, I would agree with that entirely, and it's actually fascinating, because the beta and the gamma variants from first detected in South Africa and Brazil, they have actually been in the UK for some time, but they haven't really gained a foothold. They're kind of at very low levels at the moment. So it is interesting the way that this is geographically different. But no, I'll try and get that figure.
There's also been a lot of talk about variants so far converging around similar kinds of mutations. Do you think that it's possible, as some people have pontificated or hoped out loud, that the virus has reached a kind of peak fitness? And it's that, which would mean, so it's reached this peak fitness and it's unlikely to mutate to become much more dangerous, or that A, unlikely, or B, just completely impossible to know, and it's just foolish to speculate?
I fall in the latter camp, actually. This is speculation, really trying to think about what might happen next. You know, we have seen a new fitness peak around October and November with the emergence of several variants of concern, which have different biological characteristics. And really what we're seeing here is a kind of a parallel kind of journey of us attempting to limit the spread of the virus, and the virus responding to that by being able to dodge the immune system and spread more rapidly. You know, I think it's speculation to say whether it's reached the end of that journey. If you were to press me and say, what do you really think? What would you guess? I would say that there's still headroom, actually, and that we'll see more variants emerging that have different characteristics and different combinations of characteristics. Now, one thing that people speculate is that the virus might become less pathogenic, so cause less symptoms or disease symptoms, but I see no prospect of that happening at the moment, and I don't think we should comfort ourselves with the assumption that that's going to happen, you know, this year or next year. We need to keep vaccinating, we need to keep controlling the disease and watching it very carefully. I would speculate that there's more to come yet, and that's why we just need to keep very vigilant.
So apart from this idea of peak fitness, are there any other ways that you and your colleagues feel that public perception or the public portrayal of variants has been kind of misguided throughout the pandemic, I suppose?
I would say, actually, if you kind of take a step back slightly from that question about public perception, I think they've had a lot of information that they've needed to really assimilate into their daily lives, and have had to change their behaviour. And overall, I think this has been a kind of major success. So, you know, we've all adapted, you know, hands, face, space, outdoors, vaccination, lockdowns, lack of movement. And I think that overall, people have been very, very willing to do that. I think when it comes to public understanding of variants, it is a bit more challenging. But I do think there's increasing public understanding of what these mean for them and their families, in that, you know, they're more transmissible or could evade immunity. And I think the introduction of the naming system for variants by the WHO has helped a lot. What is quite challenging is when a potentially new variant becomes reported for the very first time, and we have repeated cycles of reporting of the next serious variant that can be sort of verge on alarmist. And so perhaps we'd benefit from a system of reporting to the public that so they can understand the level of risk, and that keeps pace with our scientific understanding. So, you know, at the point it emerges, we have to say there's very little we know about this, but we'll know more in the next week or month, etc. So, you know, take the public on the journey. And this is really sort of scientists doing something they're not used to doing, and that is sort of playing out their understanding week by week, rather than kind of refining the perfect answer after a year study and you know, lots of peer review. So I think if the public knew that kind of on that journey, and there was a way of kind of trying to characterize that, then I think that could bring greater understanding, actually, so that there's kind of a move away from alarmist reporting towards, this is a new variant, this is what we know, this is what we don't know, and this is the timescale by which we will know something.
Trying to get a little bit better at actually expressing uncertainty in an honest way, which the media isn't always great at. So I want to throw this forward a little bit before you and I wrap up, and just ask a little bit about where you see the field of genomic sequencing going, and other areas you think it could be applied to, kind of any exciting new frontiers.
Yeah, well, sort of going back to earlier comments, I think machine learning and AI solutions to pathogen evolution excites me greatly, actually, as well as the black box solutions to sequencing. If we get those done, that would be amazing. I think that we could apply the technology that we've got to other really serious challenges beyond COVID-19. At the top of my list really is antibiotic resistance. So we need a better understanding of when and where resistance is emerging, and then quickly act to determine how serious this is and how we can control it. I think another area that we need to be thinking about is looking ahead to international cooperation to develop a global observatory, a system of sequencing that helps us keep a kind of genetic eye on SARS-CoV-2 variants and other pathogens. And that sort of, you can equate that to like weather forecast prediction. So we need to get one step ahead of pathogens so that we can plan, in the same way that we need to get one step ahead of weather forecasts so that we can know that something is coming. If we were to be able to do that, the next pandemic could be detected early and we could control it as fast as possible. And if we can get that system in place, one would anticipate that we wouldn't get into a situation that we're now in, where we have a global pandemic that we're trying to control.
Great. Yeah, the application of genomic sequencing to antimicrobial resistance is something that I've heard quite a lot about, and particularly in terms of waste. There's been quite a lot of genomic sequencing of wastewater, which I think is an incredible and underreported area of this pandemic. And the idea that I've heard some people talk about applying that genomic sequencing of wastewater to, I hope I'm not garbling the science there, to actually work out how antimicrobial resistance is evolving and developing.
That's spot on, Anna. And that was being done a bit before the pandemic, but it wasn't being done routinely. So researchers have certainly looked at sewage to say, what is in here that's kind of consistent with a resistant bacterium. But now that we've got sewage being sampled for SARS-CoV-2, to piggyback onto that, some extra technologies or experiments to say what antibiotic resistance genes are there actually could really also change our understanding of antibiotic resistance around the world. And the beauty of using sewage is the same as in SARS-CoV-2. You don't need to go and sample individuals to get a sample and so on, particularly in areas where testing for antibiotic resistance is not available. You could go and test whole communities to see the prevalence of resistance. And so I think sewage testing has huge potential in the future.
So we're moving on now to audience questions. So please, again, feel free to put them in the chat box. We've got one already from Molly Andrews. She said, open genome data has such incredible potential. What are some of the hurdles that need to change to achieve this in the future? And of those, what should change first?
Okay, so absolutely right that open genome data is really important. We actually, some of the hurdles, we need to change some attitudes. So we need to everybody absolutely sign up that open data sharing is important. And actually, this doesn't infringe our rights because actually they're pathogen genomes, and so it wouldn't be possible, for example, to identify the person from which that came from if it was an anonymized genome. But we will have to have a discussion about the ethics of data sharing and open data. So that's going to be important. Actually, the other thing is we need kind of mechanisms to gather all this data together to share it and link that with some limited sort of information about where the sample comes from. And for public health agencies to use this, it needs to be kind of linked in to public health information. So that kind of data flow and data linkage, it's kind of like the nuts and bolts of data sharing, and using that data is going to be really important. I think if I was going to change one thing, the top two things, one is to say we need global agreement that data sharing is key, and that needs to be followed by discussions about what the mechanisms are to actually make that happen, because this is kind of very high level discussions will need to involve the WHO, and having those discussions and getting plans in place to share that data would probably be where I would start.
One thing I wanted to run by you, just for something that I'm actually working on at the moment. Neil Ferguson said that one of the things that might have given Delta an advantage in the UK is, I think he said this about a week and a half ago, that one of the things that might have given Delta an advantage in the UK is that we've got a very vaccinated population. And because Delta has shown some ability to escape immunity, that might give it a competitive advantage over the other variants in circulation, which might be some way to explaining why, interestingly, it's just a theory of why it hasn't spread to the same extent in, for example, France or Switzerland or Denmark. What do you think about that theory? Because it's funny because the politicians here and elsewhere in Europe are saying what we need to do, that our greatest defense is vaccinating as many people as possible, as quickly as possible. But it's kind of counterintuitive to think, actually, would a partially or mostly vaccinated population be foster even greater growth of this variant?
I think it's a reasonable hypothesis. If a virus is circulating in a population that's partially immune, that variants that arise that actually have a fitness advantage, i.e. can dodge the immunity, are bound to be selected for. So I think it's a perfectly reasonable hypothesis. I mean, what we know about the Delta variant is that that you really need 2 jabs of your vaccination in order to get full immunization. So what I should say is that the vaccines that we have today, they work against all variants of concern. But after the first jab, you only get only about a third of people get immunity, and they need the second jab in order to get that. And so it's important to have your second jab. However, in some ways, that hypothesis doesn't really help us, because the way out of this pandemic is vaccination. So we shouldn't encourage kind of a discussion about something about which says, well, we can encourage discussion, but we have to vaccinate. We absolutely have to vaccinate to get people, to get the world sort of move forward from the pandemic. And what I would say is that it's an interesting question or hypothesis, but what I'm more interested in doing is really focusing on getting the vaccines out to people, and then using genomics wisely to see what's emerging in response to that, because it's kind of like a cat and mouse game, isn't it, with what we do and then how the virus responds. So yeah, I think it's perfectly reasonable to suggest that, but that in some ways is what we might expect.
Great. So we've got a few more minutes, and there's 2 questions that have come in, and we'll see if we have time to answer both of them. One is from Jack Coopy. He says, how could predictive medicine change people's health in the future, and how can it be inclusive for all?
Well, I think that we're already seeing predictive medicine coming in a broader sense. For example, or one example is trying to I don't know if this is quite consistent with what you're thinking, Jack, but for example, reading X-rays or CT scans, and actually a machine reading those instead of a human, and getting better and better at being able to read that. But this is early days for predictive medicine. It's early days for predictive genomics, but I'm quite certain that predictive medicine is kind of here to stay and will only grow. Equity for all, I think that's a kind of deep question. One can only hope that actually we can share all of our learning with populations everywhere.
And then a final question here. We heard a lot recently about vaccine escape variants. How long do you think it will be until we see these in the public sphere, if at all? So I think, I guess I'm interpreting that question as, when are we going to see a list of the variants clearly set out that have escape properties?
Yes. Well, we do have vaccine escape variants, but as I say, it's partial escape, not full escape. But we do already have a list of mutations and their impact on Immunoscape, and that is on a website. It's called cogUK Mutation Explorer. It's open access. People can go and have a look at that, so they can actually compare a mutation and what impact that has to treatments, for example, monoclonal and polyclonal antibodies. So do go and have a look at that, because that is available at the moment.
Okay, excellent. Well, I think we can probably wrap up there. Got about 1 minute left. Thank you so much for joining me, Sharon. It's always a pleasure to chat with you.
Well, thank you, Anna, and thank you to yourself for such a great conversation. Also to the organisers for asking me along today.
Wonderful. Thank you, Anna, Sharon. I will be paraphrasing you, Sharon, there about the need to democratize, open source genomic data and actually democratize genomic technology as a whole, globally. Thank you very much.